Hi, my name is Paul Khalil, and I will be talking to you about sternal fractures picked up on point-of-care ultrasound. I'm coming to you from Nicholas Children's Hospital in Miami, Florida. I'll go over the goals and objectives, including indications, which probe to use, some anatomy, and an illustrative case. So, the indications for looking for sternal fractures are reproducible chest pain after blunt trauma, as well as chest pain that's reproducible after a hyperflexion injury. I use the linear transducer when I'm looking for these fractures because there's not much adipose tissue between the skin and the sternum typically. You also want a high quality image, and the higher frequency probe allows you to do this. So for the image acquisition, make sure that you scan from an area of no pain to pain. Use lots of gel and always scan in two planes when you're looking at bones. So this is an image of the normal anatomy of a sternum in a child that still has open growth plates. You can see in the two areas on the left and the right that this child still has open growth plates and the edges are nice and round. Here is an image of the abnormal anatomy that you can see. The dotted arrow on the left has a normal growth plate where the edges are nice and round. On the right with the solid arrows you have the buccal fractures in the sternum as well as small areas of hematoma above it. And again, you can see the disruptive cortex of the bone with the solid arrow. In this image, you have the sternum in short axis with a small hematoma above the little buccal in the bone. Pearls and pitfalls. So the trick when looking at the sternum is to watch out for growth plates because some of these kids don't fuse until they're 25 years old. So that's pretty much everyone you're going to be seeing in your pediatric emergency room. Again, scan from normal anatomy to abnormal first. That way you can see what normal looks like. And if you are unsure if it's normal anatomy versus a fracture, you can always go back and look at normal first. So, the illustrative case. I had an 8-year-old girl that presented to the emergency room with chest pain after a fall in the bounce house 2 days prior. She said that when she landed on her shoulders, which caused her thorax to be hyperflexated. She reported to the emergency room with mid-sternal chest pain without any palpitations or shortness of breath, but just pain isolated to that one area in the mid-sternum. Her vitals on arrival, her heart rate was 90, blood pressure was 108/48, respirations were 20 with an O2 saturation of 99%. On physical, the only thing notable was that she did have that reproducible mid-sternal chest pain. A chest x-ray was ordered that showed a normal sternum. On ultrasound, you can see on the right that she caused herself a buccal fracture by that hyperflexation injury. The heart, cardiac, and lungs were normal on POCUS, and she was discharged home safely with NSAIDs and strict return precautions. So, summary key take-home points. Always look from normal to abnormal. Use lots of gel because it can be painful if you're putting the probe over a fracture. Look into two planes whenever you're looking at bone, and always watch out for the growth plates. And my name is Paul Khalil. I am the ultrasound director at Nicholas Children's Hospital in Miami, Florida, where I did my PEDS residency and my PEM fellowship. I did my POCUS fellowship at Denver Health, and I worked at Louisville Norton Children's Hospital for a couple years after before returning to Miami. My research interests are regional anesthesia and musculoskeletal, and you can contact me at my email or find me at my Twitter handle. And here are my references. Thank you.